So Dr. Weyer Jamora is a neuropsychologist, which really is a person who specializes in brain health and wellness through some kind of injury or treatment that impacts our thinking and our overall well-being. She hails from San Francisco. She is at the UCSF team. She is honestly one of probably 10 of us neuropsychologists in the country that has expertise in primary brain tumor and brain metastases. She has developed amazing cog rehab programs. She truly is a leader in our field. I'm so excited to call her my colleague, but also my friend, and you guys are in for a rare treat to have her here all the way from California. Dr. Weyer Jamora.
Wonderfully just gracious introduction. So I hope to live up to those kind words. And I am a little bit, I definitely don't bite. Today I have a bit of an injury, so I'm more like live long and prosper than biting. So I appreciate you. So yes, I'm really excited today to talk more about an area I feel really, really excited about, and it's nice to see people here that are friends and others, and hopefully I can help you, we can discover together some things that may be helpful to you in terms of brain health and also some strategies to live well in the midst of brain tumor. So thank you for coming today, I really appreciate it. So as Dr. Logan said, my name is Chris Weyer Jamora. I'm a registered nurse and also a rehabilitation neuropsychologist. So while I don't work as a nurse now, I always feel like once a nurse, always a nurse. You always bring that with you wherever you go. And so I try to have a little bit of a different look at things. I try to be a bit more on the holistic side in terms of looking at both behavior as well as the biologic bases, or what are some of the things that we know about neuroscience that can help us live well with brain tumor. So that's what I'm hoping to talk with you today about. Sharing some evidence-based strategies, so looking back at the literature, what do we know and what do we don't know, and then in ways that even if you don't have access to someone in your local community that does the type of work that I do, what are some things that you can kind of think about for yourself to be able to begin looking at your day-to-day. So I don't have any disclosures. So when we talk about brain health, one of the things that the folks that I work with, my patients that talk about again and again, is that the thinking changes that patients experience it's just very, very common. And also and life changes and emotional changes. And so many people notice these changes in the way they are thinking and their forgetfulness, and also it's hard to kind of keep up in conversation, and it can feel really frustrating and scary. And so my goal today is to share some practical strategies that can help. And by the end of the session, we're hoping that you'll be able to kind of be able to name some of those things in conversation with me about why these changes in thinking occur, how these changes affect your daily life and sense of self, because you probably know that, you're the expert in that in many ways. And then also, what are some concrete steps that you can take, or maybe the literature says that can help to manage some of those changes. And again, it's definitely not about perfection. It's more about just talking about some of these tools that time and time again, the folks that I work with tell me that, oh yeah, that actually kind of worked. And then that gives me a sense of, okay, well then we need to investigate and study that more. So oftentimes it's that conversation with my patients and I that help to spur along these research ideas. So I'm hoping you'll also share today with me some of the things that you notice work for you, so that way we can help to continue to understand that together. So all of us from time to time have had the experience of forgetting a word, going in the other room, not remembering while we're there. You don't need to have a brain tumor to have that. Forgetting where you parked your car and wandering around looking for it. And these are really common lapses and really normal, and especially more so whenever we get tired. But one of the things that we notice that after people have brain tumor, or metastases to the brain, that it can be very hard for them to function in their day-to-day like they had before. It's much more common than what they had before, and it can get in the way of their daily life. So in fact, studies show that up to 83% at some point in the tumor journey will end up having some changes to their thinking that shows up on testing. And that these changes really can affect more than just your thinking. They can affect your mood, cause you to worry, feel much more stressed in your daily life, and make it harder for you to do the things that you need to do. And also, other people might struggle to see it like you do. So sometimes there's this invisibility that people experience, that people can look at you and think, oh, yeah, you're done with your surgery, you're done with your chemotherapy, you're done with your radiotherapy, you're doing great. But there's maybe you experience that in a very different way than other people do. So there can be that kind of almost invisibility to it. And really these experiences are very real, that yes, you can experience not being like yourself as you were before, and other people can also experience you as doing well. Both of those things can be true at the same time. So why do some people have more problems than others after surgery? Well, I think the short answer is we don't know, but we have some ideas. And oftentimes there isn't just one reason. So sometimes it can be where the type of tumor, or it can be the treatments that you've had, or how many times you've had the tumor over and over again, or surgeries, and that sometimes the first time you have surgery or first time you have treatment, maybe you're okay. But then as successive surgeries come around, you're noticing that you're not really able to bounce back as quickly as before. Other people, they can. Also, sometimes if you have other health conditions like high blood pressure, diabetes, maybe you have sleep apnea that maybe you're in the process of trying to get figured out, and then you're noticing that your brain is having a harder and harder time. So these changes don't always happen, don't always stay the same, and that they can change over time, and that these thinking skills, depending on fatigue, stress, and other life circumstances, you can have these, we call them symptom flares. So at the end of the day, you can feel much more tired, but then in the morning, maybe you don't feel it doesn't feel as bad. So not just over the course, but also day to day, it can change too. So this is one of the ways that we think about how it changes over time. So before you have the diagnosis, some of the patients that I work with, they'll say, leading up to it, I was having kind of a harder time at work. I didn't realize, but I was having a harder time. Like at the end of the day, I would be so much more tired. And so there was a gap between what they were needing to navigate with and their own kind of experience of what they could do and their skills. So that we call it the gap between what is expected of them and where they expect to be and kind of what they can do. And then as you kind of go through treatment, that gap can widen more and more and more. Especially after surgery, you can really not feel like yourself. You can